that IPC career section is still going on, ma'am.
We can
You can
delay
continue.
if that's the best thing to do.
Yes, ma'am. Anyway, we'll post this recording session in the LearnX.
Right. Okay. Okay. So we are actually, you're all into 3/4 of your journey of your IPC to not IPC DIPSI course. So hearty congratulations for that. And myself, I'm Dr. Srivalli. So I've done my post graduation in medical microbiology in United Kingdom, my MBBS in India. Then I went to UK, did my post graduation. Then came back 5 years ago. I was working as assistant professor and infection control officer in medical college. I worked there for 4 years. I also had experience as working as a consultant in infection prevention control in WHO in India office. And I am one of the first students of this DIPSI course. So, yeah. If you don't mind, can you please introduce yourself so that we get to know each other during this course of 1 month?
Yes, ma'am. I can call the names in the participants list. They will introduce themselves one by one. Then it will be easy.
Yeah, please unmute yourself and introduce rather than putting the information in the chat.
Yes, ma'am. First, Abdul Mannan sir. Can you introduce yourself?
Yes, I'm Abdul Mannan Leskor. I'm from Assam. I have done my MSc MLT microbiology from JIPMER and now pursuing the IPC and also PhD. Thank you.
Wonderful.
Anushri ma'am.
Good evening, everyone. Myself, Dr. Anushri. I am from Mumbai. I have done my MBBS and MD in microbiology. Now I am associated with the standalone lab Suburban Diagnostics in Mumbai. Thank you.
Wonderful. May I know, how are you interested in doing this DIPSI course and how will it add to you?
Yes, ma'am. We get samples from many hospitals, and we are even attached with multi-specialty hospitals. They demand for scientific visits as well as for antibiotic stewardship program. They ask for the monthly sensitivity pattern.
Wonderful. Wonderful. Thank you.
Next, Mamta ma'am. Mamta ma'am, can you introduce yourself?
Okay, let's do this. Whoever is willing to introduce themselves, please do introduce and then we'll start the session.
Okay, start one by one. Those who want to start, they can start.
Hello, ma'am.
Hello.
Yeah, this is Dr. Prasanna from Tirupati, ma'am. I have done my DNB in microbiology after completing my MBBS. And currently, I'm working with a tertiary care hospital and I am the hospital infection control team head. So I was looking forward from DIPC to get some useful inputs.
Wonderful.
Thank you.
Hello, ma'am. Good evening. I am Dr. Pooja Shankar. I have done my MD microbiology from JNMC Belgaum. And currently, we are having our own lab in the name of Cardis Labs in Jaipur. And we also have a 60-bedded tertiary care pediatric center. So I wanted to join this course so that I can supervise the infection control and prevention part in our hospital.
Wonderful.
Good evening, ma'am. My name is Chitra. I'm working as an infection control nurse. I'm staying in Hyderabad. That's it, ma'am. I'm an infection control side. I'm an 8 years experience, ma'am. Already I did my infection control certificate in Medversity Apollo and certificate course in New York, ma'am. New York.
Okay, wonderful. So you've been building too much of knowledge along with experience in IPC. Wonderful.
Yes, ma'am. Thank you, ma'am.
So
Good
shall we
evening,
start?
ma'am, and good evening, all of you. Myself, Anjum Parvez. I'm from Delhi. I have done my Master of Healthcare Administration, and at currently I'm working at KSA Abha International Private Hospital as a IPC coordinator and CSD supervisor. Thank you.
Good evening, ma'am. I'm Ishwar. I've pursued MPH from IIPH Gandhinagar, and currently now I'm working for Ministry of Health and Family Welfare, New Delhi, as a consultant. Thank you.
Wonderful. In which area, Ishwar Garu? Which area are you
Well,
working in the Ministry of Health?
yeah, ma'am. I'm in the area of policy planning and public health practices. I build policies. Thank you.
Good evening,
Good
ma'am.
evening. Yeah.
Good evening, ma'am. Good evening, everyone. I'm Nawaz. I'm infection preventionist for Aster Hospitals, Dubai.
Wonderful.
Hello, ma'am. Good evening,
Hello,
ma'am.
ma'am. This is Dr. Ramesh.
Hello, Dr. Ramesh. Ramesh.
Yeah, please go ahead. Yeah, I'm Dr. Ramesh from VIT Bellu. I'm assistant professor in the Department of Biomedical Sciences. I'm working in the field of medical microbiology, especially antibiotic resistance and bacteriophage therapy.
Hello. Hello, ma'am. Good evening, ma'am. This is Dr. Abhinami from Chennai, ma'am. I'm just working as an infection control officer in one of the medical college hospitals, Savita Hospitals in Chennai, ma'am.
Wonderful.
Thank you.
So shall we make a start?
Yes, ma'am.
Yeah. Let me share the screen. Are you able to see my presentation?
Yes, ma'am.
Yes, ma'am.
Okay. So I've contributed to this module IPC 202, best practices for the prevention of hospital-acquired infections. So yeah, I've already introduced myself, and yeah, the chapters of this are really basic, but the strong, which makes the strongest foundations for the infection prevention and control. May I ask, actually, one of you to really tell me what does infection prevention and control mean? How do you define infection prevention and control?
It's preventing the occurrence of infection as well as keeping in control so that it will not spread. Even the once the infection comes, it will not spread. To the transmission rate, we should avoid if there is an outbreak or anything like.
Okay. So we have a WHO definition for it. Okay. So the IPC is a scientific approach and practical solution designed to prevent harm caused by infection to patients as well as healthcare workers. Okay. So this is just the summary of whatever you've already said in a different way. So to prevent the infections, these are the basic things like standard precautions are needed, transmission-based precautions, the environmental cleaning, then the surveillance, then IPC in various different areas like laundry kitchen, also IPC of ICU, CSSD, etc. are also important. But they can be summary of all these. Then occupational health, antimicrobial stewardship, and a very special unit of this is the WASH. Have you heard of WASH, the term WASH in healthcare facilities earlier at all? Maybe our friend who is working in Ministry of Health would have had a good idea of it. Hello, are you able
I'm
to?
sorry, ma'am.
Yeah.
Yeah, ma'am. Could you please repeat? I'm sorry.
No, have you heard of the term WASH?
Yes, ma'am.
You have.
Mm-hmm.
Right. Okay. So for those of you who haven't heard about the WASH, I'm going to go a bit elaborately on WASH. But for all the other units, I'm just giving the highlights of this WASH. Highlights of the topics. And last but not the least, for 10th group, we've given this exercise because there are only 9 units in this module. So we've given the exhaustive list of IPC and AMR professional organizations, global agencies, accreditation organizations, IPC guidelines, and resources. So you need to collate the data and just present. So how much ever you can, the group 10 can present this. Actually, I have one issue. I'm not able to see the participants in this mode. Is there a way I can see them, or at least the names? Spurti?
Ma'am, if you put the full screen, then it's not possible, ma'am. If
Right.
if you kept like this, then it will be problem for students to not,
Okay,
they
right.
can.
So fine. That's fine. Right. I want to bring your attention to this Bloom's taxonomy. So this is to fulfill the educational learning objectives. You can look at this taxonomy and find where you are. It is a pyramid which again is further divided into 3 domains. The cognitive domain, which is at the bottom, like remember and understanding is the cognitive domain, right? And there is affective domain, which is apply, analyze, and there is a psychomotor domain, which is evaluate, create. You might be thinking, what is the relation of this pyramid to the IPC? So the purpose of bringing this here is, I don't want you to look at the lessons and present the theory part of this, especially the 202 module. I want you to be in this middle, like, the apply domain and analyze domain. So you can, when you're doing your presentations, you can think of real life scenarios, apply them and analyze them. You can put up a video, and then you can critically appraise, like, whether the practices that are shown in the video are right or not. You can take up complex questions and then compare and contrast or appraise, or you can look at the literature, or you can discuss, debate any topic, or you can present as a quiz as well. Yeah. So an example is given in unit of the needle stick injury. So here I have presented a scenario. Then I have posed a lot of questions, and these questions will be answered in the learning material. Okay. Then I have actually added comments in some of the learning materials that, please put your thoughts in e-learning portal. So where if you're interested, then you would actually, I encourage you to be interested and put your comments or any of your thoughts or your practical experiences in the learning portal and be part of the discussion, because that discussion will help you a lot, and it will help you build strong relations between yourselves and between us, so that whenever if there is like a need to approach, sometimes, like, we are in real life situations, we find it very difficult to ask anyone, like, we might think that it is a very silly question, but if it's your friend, then you can ask. That feels like that forms a very strong networking skills as well, along with learning. And then I want you to think about the lessons that are learned through the scenario and put them down. So this is like how you're probably, this is like one of the ideas where you can present your topic. So the other ideas are, like, drawing connections. That is practice of doing environmental swabs, like in OT and ICU, especially, for accreditations before the NABH inspections, or if you're from any other country for the inspection sake. So what is the evidence for it? Is it required? Should we do it? Should we not do it? And is it a way of monitoring environmental cleaning? And what are the other ways that you can monitor the environmental cleaning properly? Or you can do appraisal of current recommendations for fumigation. You can look at the evidence for using double gloves or coveralls, during the COVID-19, because it comes under PPE, standard precautions PPE. Is there evidence? Is it required? Has everyone gone overboard? So this will all help you to develop critical thinking, which is very much required for IPC professionals. And then the other questions that you can take are, what is the rationale behind hand hygiene after removal of the gloves? Pick up any problem on hand hygiene, environmental hygiene. You can take an audit and present. You can also take this platform for if you're if there is like a complex, you can present a complex outbreak scenario and then present what are the multimodal strategies that you can implement to overcome that. So it's up to you, how you can experiment and go around in this module. The first unit of this module is WASH in healthcare facilities, where the objectives are you should be able to explain why WASH services are priority in healthcare. Describe the WASH and IPC in healthcare facilities, then the methods to improve the WASH, and then summarize during WASH. So you might be wondering, why am I saying WASH, WASH, WASH? So WASH includes the five the components. WA stands for water, provision of the water service. S for basic sanitation. And then H stands for hygiene, which includes three different hygienes: hand hygiene, and then environmental hygiene, and then basic healthcare waste management. So we've already seen what exactly is IPC according to WHO, and IPC occupies a very unique position in the field of patient safety and quality healthcare. And can anyone tell me what exactly is quality healthcare? So the dimensions of quality healthcare, are you able to hear me still?
Yes, ma'am.
Okay, thank you. Sometimes I wonder if I'm just speaking to my screen or so yeah. So the dimensions of quality care are, the care that is provided in a timely way, efficient, equitable, integrated, effective, safe, and people-centered. So to provide a safe care, to provide effective care, what is needed is IPC. And what is core to IPC is WASH. So if you have the proper WASH facilities, it'll help and strengthen the IPC, and then we'll be able to prevent the infections. And if the infections are less, the antibiotic use will be less, and then we'll be reducing the problem of AMR, and then we'd also be controlling the outbreaks. So WASH really forms a fundamental building block. And I want to, the top right hand corner, there is 3 and 6. So this is like the SGDs, which are the sustainable developmental goals. There are 17 of them set by WHO, and IPC, WASH, AMR, all these will come under the sustainable developmental goals 3 and 6. So this is like for the better to improve the quality of healthcare and human well-being as well. So WASH, actually, why WASH is carved out as separate thing to IPC. It can as well be included in IPC itself, but the global surveys have repeatedly shown that there is quite inadequate WASH facilities. 1 in 4 healthcare facilities lacks basic water services. So without which the providing healthcare is quite impossible here. And 1 in 3 lacks hand hygiene facilities where the care is given. 1 in 3 facilities do not segregate waste safely, and 1 in 10 has no sanitation services. So this is like quite shocking. So WASH is definitely prerequisite for IPC, and it is also fundamental to health security, preparedness, and response efforts. And especially with the COVID pandemic, it has shown the glaringly the lacunas that we had in the healthcare system, especially these lack of the basic amenities is quite evident, and we need to improve on these before we hit another pandemic. And a healthcare facility should not be called so if there is no so so why again washes, so that we regularly monitor, we have the monitoring parameters, and we have a regular report on the performance. And based on that report, we generate budgets at the level of the healthcare facilities. And not only that, we also have the funding, planning and funding should be at the national level as well. So this is about the wash, more so is given in the learning material. So with the wash, you can, so whoever is presenting the wash, it's up to you, like, how you want to really present. Then the hand hygiene. Hand hygiene, again, as I said earlier, you have to take up a scenario, and then do the hand hygiene. The basic learning objectives of Unit 2 are defining and describing the standard precautions, where exactly they are used, what are there, moderately on hand hygiene. So, distinguishing between transient flora from the resident flora of hands. So, simple things like, after removing of the gloves, why do we need to wash hands? Even if you have carefully removed the gloves, do we really need to wash hands? What is the evidence behind it? Okay, demonstrate the transmission of pathogens by hands. And then also know very clearly what is the patient zone and healthcare zone, and when do you have to perform the hand hygiene after entering into the patient zone, and your 5 moments of hand hygiene. Then various different techniques of hand hygiene, including the surgical hand preparation, indications of hand hygiene products, etc., implementation, multimodal strategies. So for this, I recommend actually, you take up a scenario where you're not able to, like, one of the surgeon or one team out of the hospital, one department, you're not able to improve the uh, uh, hand hygiene rates. So what are you going to do? Right? Or the scenario where there is double counting opportunities, like for when you're doing the hand hygiene audit. So you can take up the scenarios, you can present more than one scenario when you're presenting, and then present the science behind it. Personal protective equipment. The learning objectives for this unit are, when exactly, what is the risk assessment that you have to do before selecting a PPE. So COVID-19 has brought us a scenario where, if you think of PPE, you would think of the whole set. The coverall, shoe covers, goggles, masks, the head caps, etc., the gloves. But it is not so. So it depends upon the pathogen, the mode of transmission, that you would select the PPE. And the donning indications for different PPE, and including donning and doffing of all the PPE is what's learned in this unit. Then Unit 4, you'll be learning transmission-based precautions, where uh, you'd be able to describe various modes of transmission of pathogens, and then basically the 3 types of contact, droplet, airborne precautions, and then a bit on positive isolation, when is it required, and for different kinds of precautions, the contact, droplet, and airborne, what are the isolations that are required, what are the PPEs that are going to require. So when you're handling the patient, when you're transferring the patients, and when exactly these precautions have to be applied, because patients doesn't come with diagnosis on day one. So you have to do the investigation. So before you are doing the investigations, like how would you screen? So now the concept with COVID-19, the concept of screening has come. into picture, but that has to be thought of for other pathogens as well. Then the syndromic and empiric applications of transmission based precautions. So when you're making a probable diagnosis, that is when you need to apply these transmission based precautions. And in Unit 5, environmental cleaning in healthcare facilities. So here I have, so these are all the stated learning objectives, that is general environmental cleaning strategies, and then SOPs for cleaning, including terminal cleaning, cleaning a biological spill, what are hospital grade disinfectants, and how do you assess the cleanliness. So here you can present an audit on disinfectants, what are the constituents of the disinfectants in your own hospital. um, so I would request you to go back to the Bloom's taxonomy, and then think, how you can create the scenarios, how you can analyze, because no one will ask you the knowledge based questions when you are a professional. People will ask you based on your application, your analysis, etc. So I request you to focus, like when you are looking at the topic, so what am I achieving here? So where am I just gathering the knowledge, or how can I apply, how can I analyze, what are the scenarios that can come up, and what can I do? Kind of thinking at the outset, like when you start the topic, would really immensely help you. Then environmental surveillance. So the general principles of microbiological sampling of the environment. So what are the conditions when sampling is required? What are the different types of sampling methods for air surveillance or water surveillance or environmental survey sampling? And then I've talked a bit about NABH recommendations for air conditioning in the operation theatre. So even here, you please pick up the questions or audits or anything, and debate and discuss. Strongly recommended. And IPC in laundry kitchen. So the best practices in laundry, linen management, linen handling and management, as well as the best practices in the kitchen. So even if the laundry and kitchen are outsourced, you still have to go and visit them, see the conditions there, how are they handling, you might still have to do the pre-wash in the hospital setting itself and then send to the laundry. How are they being sent? How is the clean laundry received? What's the process in the laundry? Where is it stored? Where is it? Then how is it dispensed, etc. So you have to follow the complete chain. You have to know and follow the complete chain. And again, that is one of the aspects that is audited and looked at. Kitchen, again, the concept of hazard analysis, critical control point, what exactly it is. Then for the kitchen also, location layout, zoning is important for the kitchen, like in CSSDO theaters. It's not as rigid, but how are things stored, how are all the infection control practices in the kitchen maintained. Then the Unit 8 covers occupational health, mainly focusing on the needle stick injury. Healthcare workers at risk of prevention of occupational exposure, who exactly are there, and what are the safety measures that we can take when it comes to injection safety practices. Then in case of needle injury, what are the steps that we need to take? What are the actions based on the injury, the extent of the injury, or whether the person who whether HIV positive or HC or hepatitis B positive. So all the steps are clearly laid out. Then the best practices to prevent the needle stick injury, the multimodal strategies. So everywhere, these are being formed, the multimodal strategies. Again, needle stick injury is one of the parameters that need to be looked at in terms of documenting the reporting, and then monthly statistics as well has to be maintained, and then healthcare workers have to be given education, including all the cleaning staff have to be given education, etc. So so the scenario, please look at the scenario and then try to answer those questions in the presentation, or you can put up a discussion even in the LearnX platform discussion forum. Then one of the most this is like one of my favorite unit. This is antimicrobial stewardship. So the antimicrobial resistance is like going up in a global scale, and at some point, maybe a few years down the lane, all we might be left with is only the infection prevention control practices, because none of the antibiotics will work. So our infection IPC practices will will lead us forward to take the to advance the healthcare industry. So what is the global action plan on AMR, and then what exactly is One Health approach? Because nowadays you're hearing more of this term One Health, and what exactly it is. What's the role of WASH, IPC, and AMR? What is the link between all those three? Then AMR surveillance is given. Then how do you plan an AMS program? Because one size doesn't fit all, as you know very well. If you have to plan a program, how would you go about it? Then what are the different approaches for the implementation? What's the role of microbiology? And then so these are the different topics covered there. Then for the group 10, this is like it is not a unit, but you just have to give a list of IPC and AMR professional organizations, etc., and then IPC guidelines and resources by topic. So are there any questions? Are there any questions at all for me? I will be available in the group, or better that we have the discussions in the LearnX platform itself, so that everyone it can be helpful to everyone, and anyone can contribute at their own leisure. We have like fixed threads, so people can go back to them and learn from them or contribute to them at later point as well. So LearnX platform would be a better platform for discussions.
Okay, ma'am.
So I am happy to take any questions on this. So did you get a chance to look at the learning material at all?
Yes, ma'am.
Yes, ma'am.
Right. I'm yet to give the questions. So the multiple choice questions will be given maybe in a week's time. Please go through the material, and then answer the multiple choice questions, and to prepare your peer learning sessions. Good evening, Dr. Andare.
Good evening, sir. Sir, unmute your mic, sir.
Good evening, Dr. Srivalli, and good evening, colleagues, friends. Sorry, for my late joining. I had some other engagement, so I had to finish that panel discussion and join somebody else and come. I hope, I am sure you would have had a wonderful session with Dr. Srivalli, who would have given the introduction to IPC 202. I'm sorry, actually, I was not at the beginning to give an introduction to Dr. Srivalli. Of course, she doesn't need one. I'm sure, by now you would all be very much into her style of teaching. So probably her style of teaching, and also her style of actually going into the detail of the subject probably would have given a glimpse of what she is. But for the sake of kind of tradition, let me formally introduce Dr. Srivalli was with us with the first course. PGD APC 2020 batch. So since then, as a student and now as the lead person or the subject matter expert, had been very closely working with Infection Control Academy of India, and she is a resource person and who is doing a great job in terms of developing the material and now actually giving the sessions to you. I would not go into her other academic and professional accolades because I don't want to spend another 10 minutes on reciting all of them. But she worked in various settings that gives her the kind of clarity of thought about what is required for this profession called as infection preventionist. Probably her training and also the professional engagement in United Kingdom, England, probably has sharpened the kind of ability to see the things from the perspective of patient centricity. Because most of us, we lose sight of why we are doing certain things or why we are learning certain things. I think the good thing about the Western education and also the practice is they're all very clear about their objectives and what is that they want to achieve through a learning process or through the practice, right? So I think that valuable experience which she gained both in India and also abroad is going to bring that sharpness which is required for this course, and also the delivery of IPC 202 in specific. So with those few words, once again, I thank Dr. Srivalli for taking part and also willingly, voluntarily actually putting herself into this risk of, getting associated with Infection Control Academy of India and also, of course, University of Hyderabad. Thank you, Dr. Srivalli. Thank you for your efforts and also for your support. And I'm sure you had a wonderful session which I missed. I would definitely go through that because I'm sure there would be some pearls of wisdom which I need to catch and probably assimilate in my learning process. As she said at the back end of her presentation, I just joined about, I think, in the last minute. I think it is very important actually to go through all those assessments with all the seriousness, so that you really gain from your participation in the course. Don't take it very lightly. Of course, we all do understand that you are a working professional and have got a lot of kind of commitments both on professional and personal front. But since you have embarked on this journey, you better make use of this journey and take as much as you can from it. That is what I say. Thank you and have a very great weekend.
Sir, thank you actually for giving me the opportunity to contribute to the module, and yeah, I feel it's a precious opportunity. Actually, I want to share my experience with all the learners here. I have, as working as infection control officer, I wanted to gain more knowledge in terms of what happens in India particularly. In the West, when we used to encounter any organism, we used to think of three aspects. One is what is it for the patient? We need to, what antibiotics we have to give. And then second thing is that automatically has to come to us is what is the infection control aspect of this issue? And then the third is what is the public health aspect? But here, it is still developing, it is budding, and it is forming. So I wanted to gain the insight. So I've done Shankar Netralaya's course, and one of my friends is doing the same. She's doing all the IPC courses. So then I embarked on this PG DIPSI. So both the times, when I was the first batch student, and and there was this outset of COVID-19, the first wave, where we don't know much what we are doing, and then this so much of happening around. I did not feel really I learned much uh, until Dr. Angareddy gave this opportunity to do the modules. So where I read a lot, I learned the science behind what we're doing, and so it was like a wonderful journey, I would say, and an excellent opportunity. And if you ever get this opportunity, please do take it up and revise, review the module or any educational material or your hospital protocols. So this will because this is a path, we are in a path of lifelong, being lifelong learners. So this is how our attitude should be, and learning is an experience, and at best we can make it a beautiful experience. So that's what I would say to everyone. And the hardest part that I felt during my PG Dipsy course or any other learning course was juggling between the professional private life, and then satisfying your needs to learn as well. So that was the hardest part, and I do understand, actually, so many of you are not there at the moment attending. I do understand all those, and I feel personally that these challenges are more for women compared to men. I might be wrong, but there we are. But you still have to attempt, because that's what gives you, I think, fulfillment and satisfaction, professional satisfaction at the end of the day.
Sure. I don't know. I cannot comment on who would have hard time, men or women, but certainly one point what Dr. Srivalli made very clear is um, the best way of learning is through teaching. So that is the very reason why we have instituted this system called as peer learning. Otherwise, I keep mentioning about it 100 times again for the sake of clarity and boring you. I mention again that especially an infection preventionist had to be a very good diplomat, apart from knowing a lot of subject and also having a lot of ability to convert that theoretical knowledge into practice. But apart from that, he or she had to be a good trainer, because at the end of the day, you're going to deal with all the other employees from class 4 to the super specialist, a rock star kind of super specialist. So you had to be very diplomatic, you had to be very articulative, and you need to definitely be a very good coach. So I think this platform provides that opportunity to not only learn, but also learn through the teaching, and add on those soft skills, which is very much part and parcel of any infection preventionist, right? Because the moment you have got a very sweet tongue, a lot of things can be kind of tied up in professional settings. If you are going to be a bully or a boss, definitely nobody is going to cooperate, because everybody looks at infection preventionists as a police. And adding to that, if your attitude is such that you cannot articulate, or you cannot take along the people, or you cannot coach, you can never become a good infection preventionist. So I think I just barged in and probably broken the schedule. I'm sure there must be a lot of questions which you wanted to ask Dr. Srivalli. So I leave this stage and hand it over to Dr. Srivalli and also Mrs. Purti. Thank you very much.
Any
Thank you,
questions
sir.
regarding the session? Yes, Pooja ma'am.
No, I was just thanking sir for his words. Ma'am, I just feel that while I'm doing this course, Mainly whatever we are learning is theoretical. So I wanted to share with everybody that in the end of our presentations, if we can give a crux or we can share checklists with each other. For example, if we take up environmental cleaning or laundry and kitchen, then after the whole lot of theoretical sessions, we can discuss in the end, what do we have to look for, 1, 2, 3, 4 checkpoints, so that it will be more practically applicable for everybody. Because in the past sessions, we have not been doing such things. So just to make it more fruitful, it's like a suggestion.
Sorry, I think, yeah, now hopefully you can hear me. Certainly we can do that. And if you look at the learning material, you can look at the list of references. And if you're in this country, and if you are going through the NABH accreditation, what they will ask you is to look at the latest WHO guidelines. And these checklists are not, purposely only few of them are given, and then a lot of references have been given, mainly because they keep changing. Sometimes if they change, if you have for environmental cleaning, for example, you have to look at the Kayakalp guidelines, and then Swachh guidelines, etc. And if they change you biomedical waste guideline, if you look at it, it's been brought in, the new guidelines in 2006, but a lot of amendments have been made. So if you give a standard checklist in the courses like this, it might not suit everyone, especially if there are people from other countries. So this is something that we can, as learners, we can share in the discussion platforms, discuss and share, and take it further, for sure.
Okay, ma'am. Thank you.
And that's the exact reason why I asked you to look at the Bloom's taxonomy, and then take up the questions, take up the scenarios, and build on them, rather than presenting the theory, because this theory is going to definitely help you, but you in real life scenarios, it's not, the theory is like within you, but what has to come out is your analysis, your replication. Those parts have to come out.
Any other questions?
You can ask me, the questions either in the discussion form or formal group. You cannot ask in the formal group, but there's informal group, so you can ask questions anytime.
Yes, for the discussion form, we have created IPC 202 discussion form in the LearnX 202 section itself. You all can check there.
So we can probably take leave for now.
Yes, ma'am. Thank you, ma'am. Thank you for the presentation, and hope the next 3 interactions will be informative and interactive.
Yeah.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you, ma'am.